Thank you. No question. The member from Cornwall Dundas South Glengarry.
Thank you, Speaker. To the Minister of Health. The health of Ontario's hospitals is suffering from a critical lack of funding. Cornwall Community Hospital occupancy rates are so high, patients have to be accommodated in hallways, empty office spaces, or any cubby holes staff can find. Yet ministry people dismiss the concern, saying the real number really happens at midnight. Would this minister really stand next to a senior heart attack patient and tell them in a stretcher in the hallway and tell them that they really only count if they're still alive that night?
Thank you. Minister of Health.
Well,
that's a bad
Mr. Speaker, of course, as the member opposite knows, we've made substantial new investments in our hospitals on two fronts, Mr. Speaker. On the operating side, we've increased the operating budgets by about 3% this year alone, Mr. Speaker, close to $500 million. And on the capital side, Mr. Speaker, we've made what I believe, I'm confident, is the largest, most substantial capital investment in hospitals in this province's history, $12 billion over a 10-year period. And we're seeing the results of both of those actions where, in many cases, quite dramatic increases in hospitals' operating budgets, Mr. Speaker. We referenced the member from Haliburton Court, the Lakes, her hospital, the Haliburton Hospital, getting a 10% increase in her operating budget last year. These are important investments, Mr. Speaker.
Parliamentary.
Thank you. Back to the minister. Speaker, the Cornwall Community Hospital reported occupancy rates as high as 138% this year, with a high incidence of alternative level care of patients facing longest wait times in Ontario for proper placement. Yet when questioned, the government says they have twice as many beds as they need until 2030. Someone doesn't know what's going on, and it isn't the waiting patients. Ministry, if as your figures say, we have too many beds, then why are the ALC patients in Cornwall waiting over a year to be placed?
Thank you, Minister.
Well, Mr. Speaker, I feel like it's perhaps a two-part answer that is required here. When it comes to Cornwall Community Hospital itself, I'm proud to say that we increased their operating budget by over $4 million last year. That was a 5.4% increase in the operating budget for that hospital alone. And when it comes to long-term care and ensuring that residents of Cornwall and the surrounding region have a place to live, that's why we're making our investments where we've, since coming into office, have built more than 10,000 brand new long-term care beds, where we're redeveloping an additional 30,000 beds between now and 2025, Mr. Speaker. But we're also looking at other opportunities to ensure, whether it's in the home or in the community or in long-term care or in the hospital, where patients and clients are getting the highest quality of care at the best possible place for them and where they want to be, Mr. Speaker.
Thank you.